Welcome to Mental Health Awareness, presented by the North Country Health Consortium staff. This webinar was developed to help frontline non-provider staff improve their awareness of mental health needs so that they're better able to recognize and manage special situations. Learning objectives. After participating in this activity, learners will be able to understand that the only difference between mental illness and physical illnesses is the body part affected. Understand and identify personal preconceptions and misconceptions about mental illness. Understand the impact that mental illness has on an individual and society. Identify symptoms of common mental illnesses. 1 in 5 adults and 1 in 6 adolescents will experience a behavioral health illness at some point in their life. Frontline staff at medical centers and hospitals are often the first people to encounter the patient, and it is often the frontline staff that notice a patient with mental health symptoms or seemingly unusual behavior. This presentation will provide some basic information about mental health disorders to help frontline staff identify symptoms and know how to respond. Mental health awareness is about understanding how mental illness can impact the way a person thinks and feels so that you can interact with them appropriately.
I'm Danny. I've lived with depression and anxiety for about 12 years. And today I'm going to be opening up about those mental health challenges with some complete strangers in the hopes that we can start normalizing conversations about mental health. Hi, I'm Danny. Nice to meet you.
I'm Colleen. It's nice to meet you too.
Cecilio, nice to meet you.
How are you?
Doing well, thank you.
I'm doing really good. Yeah.
Doing good. Yourself?
I'm actually not doing so well today.
Okay, that's honest.
Oh, it's all right.
Okay. So,
Okay.
Okay, what's going on?
can you tell me a little bit more about it? Do you feel comfortable talking about it, or?
Yeah, I can talk about it. So I've been living with depression for a long time, and this week has been particularly hard for me. So a lot of people simply just don't know what to say and what to do when somebody opens up to them about a mental health or addiction challenge. And that's really where mental health first aid can be valuable. It teaches people a concrete action plan for starting a conversation and getting somebody the support that they need, whether that's treatment or just a non-judgmental listening ear. So was it a little unexpected when I responded that I wasn't doing well, us being complete strangers until this moment?
I'll be honest, it caught me off guard.
Yeah.
You just expect the automatic response of, how are you doing? I'm good.
When you first meet someone, here there's like a huge distance.
I always feel like, how can I help someone else? So, and I know it's hard because you just want to be like, oh, sorry, okay, let me run,
And I don't think people do it because they're inconsiderate. I think it's because they honestly just don't know what to say.
Have you talked to anyone about this?
Sometimes I just don't want to burden. Yeah.
I know it feels like that, but most of the time people want to help.
Yeah.
Like everyone kind of wants to be useful to other people, so they want to help you. So
Yeah.
don't feel like you're burdening them.
That was really nice.
That's so sweet. I totally wanted to give you a hug, and then I was like, that might be weird, but okay.
No, that was exactly what you should have said.
Myself, I was thinking okay, this person is in need of help. Try your best. Listen to them. Sometimes that's the best thing you can do is just listen.
If you had cancer, you wouldn't just try to you wouldn't will yourself to get better with that. And so I hope that people just start talking about it more.
Wouldn't it be refreshing if we could take off the mask?
Yes, absolutely. Be real people.
So how did you learn how to respond that way?
My father committed suicide when I was young, and it was like a really pivotal change. And I think I spent most of my life trying to avoid that and avoid talking about that and the shame and the guilt. So I really made this decision to learn how to interact with people and be empathetic and show people that someone does care about them even if I don't know you. I think people should just ask more questions, because it's like once you get to know the person and understand that it could literally be any of us, like any of us could have this at any point in our lives, it just, how could you make a judgment on it?
Can I give you a hug?
Well, absolutely. I love hugs.
Thank you.
Mental illness is an organ disorder. The organ is the brain. Mental illness can be caused by genetics, chemical imbalances in the brain, or our environment and how we experience it. Most often, it is a combination of all these factors. Mental illnesses are very common. The term serious mental illness describes those brain disorders that are behavioral and emotional, affecting mood and thinking. These disorders result in significant functional impairment, which substantially interferes with or limits one's own major life activities. Mental illness does not discriminate. It affects people of every socioeconomic status. However, those who have barriers associated with these social determinants of health and are disadvantaged suffer disproportionately. If a child has signs of a mental health issue and their parents or guardians are not able or willing to seek treatment, the symptoms can persist and shape that child's future. The symptoms may negatively impact child's ability to learn or behave in school. She may find substances or self-medicate and act out. Adults who are diagnosed with a serious mental illness, such as schizophrenia, can be disabled by the disease. Not only the illness, but also some of the treatments for it can seriously affect a person's ability to eat right, exercise, socialize, or hold a job. Living on a disability income can greatly increase their chances of housing and food insecurity. They also have less opportunity to enhance quality of life through employment or education. Social context, including relationships with family and friends, community dynamics, levels of social support, employment opportunities, and work and school environments, can influence mental health risk and outcomes, both positively and negatively. Recognizing symptoms of mental illness and knowing the best way to respond to them is helpful to both staff and patients. As you review this short video clip, consider these warning signs and how you might think about or interact with a patient exhibiting these symptoms.
Mental health conditions are more common than you may think. 1 in 5 youth or young adults lives with a mental health condition. Do you know the warning signs? Like feeling sad or withdrawn for more than 2 weeks. Severe mood swings that cause problems in relationships. Intense worries or fears that get in the way of daily activities. Sudden overwhelming fear for no reason. Or seriously trying to harm or kill oneself, or making plans to do so. Not eating, throwing up, or using laxatives to lose weight. Significant weight loss or weight gain. Severe, out-of-control risk-taking behavior that can cause harm to self or others. Repeated use of drugs or alcohol. Drastic changes in behavior, personality, or sleeping habits. Or extreme difficulty concentrating or staying still. If you see these signs in yourself or a friend, tell a trusted adult. The first step to getting help is to say it out loud.
Symptoms are often misunderstood, leading to assumptions being made that people are just difficult. In reality, a mental illness may be preventing them from responding in an expected manner. Start by showing compassion for the person you're working with. It's always a good first step. Mental illness makes people uncomfortable. It is a group of illnesses that have long been misunderstood. Lack of understanding and discomfort with mental illness have fed the creation of myths, many of which are still alive and well. We learned the facts about diabetes and heart disease. Why not mental illness? Clearly, it affects our families, communities, and nation. As with any other illness, with the right treatment, people with mental illness can recover. Symptoms can subside or be managed effectively. When you do interact with someone who seems to have symptoms of mental illness, first and foremost, be calm. If you're concerned about the potential actions of the other person, make sure you're positioned to leave the area if necessary. People with mental illness are thought to be violent, but they are much more likely to be a victim of a violent crime than the perpetrator. Speak simply and clearly. Respond to how the person is feeling. Are you okay? Can I help you? If someone is symptomatic, know they will take more time to process and reply to what you're saying. Be patient. Repeat your questions calmly and kindly. Don't whisper, make wisecracks or jokes. Focus on one thing at a time. You can validate what they might be seeing or hearing without agreeing that that exists. Don't touch or push the person. For example, ask them to take a seat in a quiet spot. Stay with that request until they're able to meet it. Your remaining calm and quiet is very helpful to that person with symptoms. Share with them that you're going to call for someone who can be helpful.
We have all witnessed stigmatizing language and assumptions when it comes to interacting with someone that is presenting differently. We have the opportunity to make a difference in someone's life by being thoughtful in how we respond. Relating to someone you care about who has a mental illness can be difficult and frustrating, but there are strategies you can use to improve your communication with them. There may be a lot you don't know about how your loved one sees things when they're symptomatic. These tips can help you build a stronger foundation for your relationship. To get started on a better path in your relationship with your loved one, first acknowledge that you can't change them, only yourself, but the changes you make can improve your lives together. It's critical to know as much as you can about their illness so you understand what they may be going through. The National Alliance on Mental Illness has more guidance for these strategies to maintain healthy relationships at the website listed here. This slide shares some specific resources for working with particularly vulnerable populations. There are many resources available, but be mindful of your information source. It is best to use resources from non-biased, research-based agencies or organizations. Stigma can often come from a fear of what we don't understand. Unfortunately, misinformation about mental illness is commonly shared, spreading false and stigmatizing ideas. Some stigma is rooted in societies and cultures. Many cultures place a high value on social status and reputation. A mental health issue may be viewed as a public embarrassment that could damage reputations. In our culture, men are discouraged from exhibiting physical or mental weakness, which prevents them from coming forward for help. And not every culture accepts or trusts Western medical practices. Educate yourself about mental illness so your words and practices do not perpetuate the stigma that prevents so many from seeking appropriate care. How we talk about mental illness is important. Use person-first language. A person's illness should not define them. Disorders should not be used as adjectives. Rather than saying, "she is schizophrenic," use, "he is a person with schizophrenia." Compassion. Treat others with kindness and understanding. We often only know a portion of what someone is going through. Be open to hearing their story from their perspective. TV and media. Sometimes headlines and storylines don't share a true view of mental illness. If you see perpetuations of stigma in the media, on TV, in movies, or on social media, speak out. You can do so in a respectful way, educating others as you go. Perception. Treat mental illness the same as a physical illness. An annual checkup should include a check-in on your emotional health. Community involvement. Get inspired to make a difference. Take part in local events. Work with organizations. And talk with legislators to help raise awareness about mental illness. Learn the signs of suicide. Always take a person seriously if they talk about hurting themselves. Learn what to do and say so you can be confident in how you respond. Talking to someone about suicide will not cause someone to be suicidal. In fact, it may be the one thing that will save them. Know who to call to get help. The National Suicide Prevention Lifeline can be reached by calling 1-800-273-TALK. There are many types of health professionals that work together to provide behavioral health services to those in need. Psychiatrists are licensed medical doctors who have completed psychiatric training. They can diagnose mental health conditions, prescribe and monitor medications, and provide therapy. Some have completed additional training in child and adolescent mental health, substance use disorders, or geriatric psychiatry. Counselors, clinicians, and therapists are master's-level healthcare professionals who are trained to evaluate a person's mental health and use therapeutic techniques based on specific training programs. They operate under a variety of job titles, including counselor, clinician, therapist, or something else, based on the treatment setting. Working with one of these mental health professionals can lead not only to symptom reduction, but to better ways of thinking, feeling, and living. Psychologists hold a doctoral degree in clinical psychology or another specialty such as counseling or education. They are trained to evaluate a person's mental health using clinical interviews, psychological evaluations, and testing. They can make diagnoses and provide individual and group therapy. Some may have training in specific forms of therapy like cognitive behavioral therapy, dialectical behavior therapy, and other behavioral therapy interventions. Clinical social workers are trained to evaluate a person's mental health and use therapeutic techniques based on specific training programs. They are also trained in case management and advocacy services. Primary care physicians and pediatricians can prescribe medication and help to monitor a patient's progress with mental health treatment. If the mental illness is severe, they will refer a patient to a specialist, such as a psychiatrist. Primary care and mental health professionals should use an integrated approach to determine an individual's best treatment plan and carry it out. Psychiatric or mental health nurse practitioners can provide assessment, diagnosis, and therapy for mental health conditions or substance use disorders. In some states, they are also qualified to prescribe and monitor medications. Family nurse practitioners can provide general medical services like those of a primary care physician. Like primary care physicians, they can prescribe medication and can provide care best by working together with a mental health professional to determine an individual's treatment plan. Psychiatric pharmacists are advanced practice pharmacists who specialize in mental health care. They can prescribe or recommend appropriate medications if allowed in their state and practice setting. They are skilled at medication management, meaning they evaluate responses and modify treatment, manage medication reactions and drug interactions, and provide education about medications. Many have completed additional training in child-adolescent psychiatry, substance use disorders, or geriatric psychiatry. Other members of the care team include certified peer specialists who have lived experience with a mental health condition or substance use disorder. They are individuals that are in recovery and have received training to become certified to assist, and mentor a patient with the recovery process. Social workers provide case management, inpatient discharge planning services, placement services, and other connections to services that can support a patient in their recovery process. Pastoral counselors are clergy members with training in clinical pastoral education. They are trained to diagnose and provide counseling. Because of the workforce shortage in the behavioral health fields, many primary care physicians are also providing mental health services. Rural health clinics and federally qualified health centers often also employ behavioral health providers that work within the clinic. This model is helping to integrate physical and behavioral health care services, moving treatment towards a whole person focus. If, however, a patient has a mental illness that is serious and persistent, the primary care provider will need to refer the patient to a specialist, often employed by a community mental health center. A community mental health center provides public mental health treatment services. Community mental health centers in New Hampshire are independent, nonprofit organizations that contract with the state of New Hampshire to provide mental health services primarily to the Medicaid population and those disabled by their serious mental illness. Community mental health centers offer a broad range of services, including outpatient treatment, medication management, case management, intensive community treatment, and day programs. They may also provide therapeutic and supportive residential services. In most cases, these services would not be available from a private practitioner. Community mental health centers are also required to provide 24/7 emergency services that can be accessed through the phone or emergency departments by anyone at any time of the day or night. Any behavioral health provider can work in a private practice, meaning they work for themselves. They set their own fees and handle their own insurance. They meet with their patients in an office or out of their home and provide regularly scheduled counseling to assist their patients in their recovery process. Frequency of appointments depends on the patient's level of need. There are also group practices that combine the services of different mental health providers under one roof. These practices do not provide the array of case management and intensive services that are found in a community mental health center, but have more options than a single private practice would have. There are many barriers patients face for seeking treatment for mental health and substance use disorders. This slide shows some common barriers identified for those in northern New Hampshire and other rural areas. Cost is a large barrier, especially for those with no insurance or with minimal coverage with high deductibles. Stigma is another large factor. Someone may feel that they are being judged or that their position either at work or in the community is at risk. The independent, strong-willed culture of many North Country residents does not lend itself to getting help for something they may struggle to understand themselves. Behavioral health providers and treatment facilities in northern New Hampshire are very limited. Even when people reach out for help, they may not be seen right away. For those without transportation, regular travel locally or going a couple of hours away for regular appointments is out of the question. There are many non-medical forms of self-therapy that complement medical interventions. For example, peer support groups are made up of people with similar behavioral health needs who come together to share and support each other. These groups do not offer clinical therapy, but rather understanding and support from those who have shared experiences. As with any support group, the impact of speaking with others who share your experiences can be profound. National organizations, such as the National Alliance on Mental Illness and the Depression and Bipolar Support Alliance, provide training for leaders to organize these groups around the country. In general, the individuals that lead and facilitate the group are peers themselves, but rooted firmly in recovery. Family members and friends are on the front lines helping someone with a mental illness to connect to treatment and supporting them as they move towards recovery. While they may not be living with the diagnosis directly, they are often the primary line of support to the individual with behavioral health needs and frequently serve as caregivers, advocates, and intermediaries to service providers. Family support groups provide support and education to family members from others who have been there. There are also many other types of self-help that people healing from a mental health or substance use disorder find helpful. These can include expression through art or music, physical exercise, or quiet exercise such as yoga or meditation. Mental illness is an illness like any other illness. It doesn't care if you are rich or poor, educated or not, live in a big house or a small apartment. It does not discriminate. Recovery is possible, just like with any other illness. People with mental illness would benefit from kindness and understanding, just like someone with any other illness. You can make a difference. As we mentioned earlier, there are many resources available to help you understand mental illness better, but not all are reliable. These websites are for agencies and organizations that offer non-biased, research-based information. If you would like to know more about other behavioral health learning opportunities available in your area, including the mental health first aid training, please contact the North Country Health Consortium by calling 603-259-3700.